All right, welcome back, everyone, to the 21st Century Man podcast. Today, we are diving deep, and I mean deep, into a topic that's absolutely critical for every single guy out there.
hmm
We're talking about reducing your risk of heart disease. And to guide us on this journey, we're turning to, you guessed it, the 21st Century Man, that incredible book that's been our companion for, well, quite a few episodes now.
It has.
And specifically, we're cracking open chapter 6. This chapter really drives home the fact that heart disease isn't just some abstract statistic.
Yeah.
It's a real threat that affects nearly 500,000 men every single year, and it can have a huge impact on your life.
Yeah. I mean, think about it. It affects your energy, your ability to work, even your ability to just enjoy, you know, simple things like being active.
Right, exactly. It's not just about living longer, it's about living better.
That's it.
So let's get into it. Chapter 6 kicks things off by laying out the most significant risk factors.
And it does not sugarcoat anything. It comes right out and says the two biggest culprits are smoking and, no surprise here, having a history of a previous heart attack. And the thing that really jumps out is that smokers, on average, have heart attacks a full 10 years earlier than non-smokers.
10 years, that's wild.
The big difference, it's a decade.
A decade, yeah. So basically, if you're smoking, you're fast-tracking yourself to potential heart problems. All right, so let's dig deeper into these risk factors. The chapter then goes on to break them down into lifestyle habits, things that we can, potentially control. We already touched on smoking, which more than doubles your risk.
Right.
But what else should guys be paying attention to in their daily lives?
Well, there's a bunch of things, but I mean, some of the big ones that the book highlights are, being overweight or obese, having that, sweet tooth that a lot of us have, craving those sugary treats, those comfort foods like pasta, all those things that, we love, but maybe aren't doing us any favors.
Mm-hmm.
And then, of course, there's not getting enough exercise. And then stress. I mean, we're all under stress, right?
Yeah.
Whether it's work, family, whatever it is. But chronic stress, that really takes a toll on your heart.
Yeah, for sure. And it keeps going, too.
Yeah, it does.
Drinking more than 2 alcoholic drinks a day, popping those over-the-counter meds with caffeine or stimulants. And then, of course, there are the recreational stimulants like cocaine and amphetamines. This chapter really drives home the point that our everyday choices, they can have a real impact on our heart health.
Absolutely. And it's not just about those lifestyle habits either. There are also underlying health conditions that can significantly increase your risk.
Right.
I mean, obviously, having existing heart disease is a big one. But then there's high blood pressure, which we'll talk more about in a bit.
Yeah.
And then there's diabetes. This book, it really hits you with the facts. It says over 80% of people with diabetes will end up dying from some type of cardiovascular problem.
Wow.
Yeah, it's a really sobering statistic. It really shows you how interconnected these things are.
It does, yeah. And the chapter goes on to list a few more. Obesity, which it defines as having a waist size over 40 inches.
Yeah.
High cholesterol. And then this one might surprise some people, gum disease.
Yeah, that one always throws people off a little bit. But the research on the link between gum disease and heart health is getting stronger and stronger. It's not totally clear how it all works, but the takeaway is clear. Take care of your teeth. Brush twice a day, floss regularly, and don't skip those dentist appointments. The book even mentions that chewing sugar-free gum after meals can help a bit.
So there you go. Another simple thing you can do to potentially protect your heart. All right, so besides all of that, Chapter 6 also mentions some prescription medications that can affect blood pressure. Things like Ritalin for ADHD, steroids, some migraine meds, and even those over-the-counter decongestants.
Right. It's always a good idea to have a conversation with your doctor about any medications you're taking, even those over-the-counter ones, and talk about any potential side effects.
Absolutely. So we've covered a lot of ground on risk factors, but now the chapter shifts gears a bit and talks about what it calls givens, things that we can't change, but we still need to be aware of because they affect our baseline risk. Age is a big one.
Yeah. The risk of heart problems basically doubles every decade after you hit 45.
And then, of course, just by virtue of being a listener of this podcast, there's another given, being male.
That's right. Men tend to have heart attacks about 10 years earlier than women. It's just, one of those biological realities.
And then there's genetics. If you've got a close relative, like a parent or sibling, who developed heart disease or high blood pressure before the age of 55, your risk goes up.
Right.
And finally, Chapter 6 points out that certain ethnic and racial groups have a higher risk of heart problems. We're talking about African Americans, Hispanic individuals, Native Americans, people of Hawaiian descent, and some Asian American populations.
It's important to be aware of these factors, even though you can't change them.
Absolutely. But here's the good news. even if some of these givens apply to you, there are still things you can do to reduce your risk.
Right. You can focus on the things that are within your control.
Exactly. And that brings us to the next part of Chapter 6, where it takes a closer look at specific cardiovascular conditions. The first one up is high blood pressure, also known as hypertension. So, to start, Chapter 6 defines blood pressure as basically the force of your blood pushing against the walls of your blood vessels. And it makes it clear that it's not the normal ups and downs of blood pressure that are a problem. It's the consistently high pressure that causes damage.
And the book does a great job of explaining how dangerous sustained high blood pressure can be. It puts a lot of strain on your heart and blood vessels, increasing the risk of damage to your heart, your eyes, your kidneys. And it significantly ups your risk for a heart attack or a stroke.
And here's the scary part. High blood pressure is often called the silent killer because a lot of the time, there are no symptoms. You might not even know you have it until it's already caused some serious damage.
Right. You could be walking around with high blood pressure and have absolutely no clue. That's why it's so important to get it checked regularly.
Exactly. And the book points out that men are actually less likely than women to get regular checkups. So guys, we really need to be more proactive about this. So how does blood pressure work exactly? The chapter explains that blood pressure readings have two numbers.
Right. You got the systolic and the diastolic.
So the book breaks it down like this. The systolic pressure, which is the top number, is the pressure when your heart beats, when it's pumping blood. And the diastolic pressure, the bottom number, is the pressure when your heart is at rest, between beats.
It's like a snapshot of the pressure in your arteries during those two phases of your heartbeat.
And the chapter provides a handy chart that shows the different categories of blood pressure. Normal blood pressure is less than 120/80. Then you have elevated blood pressure, which is between 120 and 129 for the systolic and less than 80 for the diastolic.
Right.
And then you get into hypertension, which is divided into stages. Stage 1 is a systolic of 130 to 139 or a diastolic of 80 to 89. And stage 2 is anything higher than 140 systolic or higher than 90 diastolic.
It's a good guide to have so you know where you stand.
Absolutely. And the book also reminds us that getting your blood pressure checked is super easy. You can do it at your doctor's office, of course, but you can also get it done at a lot of pharmacies and sometimes even at your local fire station if they're not out on a call. Plus, home blood pressure monitors are pretty affordable and easy to use these days.
Yeah, you can even find some that connect to your smartphone.
Oh, that's cool. All right, so moving on. Chapter 6 dives into another big one, coronary heart disease, or CHD. So the book explains that CHD is primarily caused by a process called atherosclerosis. It's basically the buildup of plaque inside your coronary arteries, which are the blood vessels that supply your heart muscle with all the oxygen-rich blood it needs.
Right. And this plaque, it's like a sticky gunk made up of cholesterol, fats, and other stuff.
Yeah.
Over time, it narrows those arteries, restricting blood flow to your heart.
So what's the big danger here?
Well, a few things can happen. The artery can become completely blocked, or a piece of that plaque can break off and form a blood clot. And if that happens in an artery that's supplying your heart, it can cause a heart attack. And if it happens in an artery leading to your brain, it can cause a stroke.
So basically, atherosclerosis is setting you up for some potentially life-threatening events.
That's right. It's serious business.
And like you said, the risk factors for CHD are very similar to those for high blood pressure.
Exactly. They kind of go hand in hand.
All right. The next condition that the chapter tackles is angina. And according to the book, this is the most common symptom of coronary heart disease.
Yeah, it's a pretty classic sign.
So what is angina exactly?
Well, it's basically chest pain or discomfort. It's often described as a feeling of heaviness, tightness, pressure under the breastbone, but it can also radiate to other areas like your neck, jaw, arms, even your stomach or upper back.
Oh, wow.
Yeah, it can be kind of tricky because it can mimic other problems.
Right.
But the thing is, it's usually triggered by certain things like physical exertion, strong emotions, anger, stress, that sort of thing. Sometimes even sudden changes in the weather or eating a large meal can bring it on.
So if you're feeling any of this kind of chest pain, especially if it's brought on by those triggers, what should you do?
You should talk to your doctor right away.
Yeah.
You don't want to ignore this stuff.
Yeah.
Angina is a warning sign that you're at increased risk for a heart attack.
And heart attacks, obviously, those are serious business. Chapter 6 really gets into the nitty-gritty of heart attacks, which are also known as acute myocardial infarction. And it points out a pretty disturbing statistic. Men who have heart attacks are actually more likely to die from them than women of the same age.
That's right. It's a fact that a lot of people don't realize.
And the book explains that a heart attack happens when a part of your heart muscle is deprived of oxygen.
Right. It's usually because there's a blockage in one of those coronary arteries, and the blood can't get through to deliver oxygen to the heart muscle.
And without oxygen, that heart muscle tissue starts to die.
Hmm.
And as we've seen with the other conditions, the risk factors for a heart attack are very similar.
Exactly. It all ties together.
All right, so let's talk about symptoms. What should guys be looking out for?
Well, the book lists a bunch of them, but some of the most common ones are chest pain.
So it's similar to angina.
Yeah, it can be a pressure, a tightness, a crushing sensation. It can feel like a burning or choking, or even just an ache in the center of your chest. And it might be accompanied by shortness of breath, a rapid or irregular heartbeat.
Mm-hmm.
You might feel restless, dizzy, nauseous, or unusually tired. And then there's sudden pain that can radiate to either or both arms, your back, shoulder, jaw, neck.
Oh, wow. So it's not always just in your chest.
Right. It can spread out.
Yeah.
And it's important to be able to distinguish this kind of pain from, just a muzzle strain or something like that.
Right, for sure. What else?
Sudden shortness of breath is another big one. A racing heartbeat that doesn't go away quickly. And then, sudden cold sweats, nausea, or feeling faint.
Yeah.
Those can be signs that your body is going into shock.
So if you're experiencing any of these symptoms, what should you do?
Call 911 immediately. Don't wait. Don't try to tough it out.
Right.
Time is of the essence when it comes to a heart attack.
Absolutely. The book really emphasizes that, when in doubt, always call for help.
Right. It's better to be safe than sorry.
100%. And then it goes on to talk about what doctors call the golden hour, the first hour after the onset of a heart attack.
Mm-hmm.
It says that getting medical treatment within that hour is critical. It can minimize the damage to your heart muscle and can even, in some cases, reverse the effects.
Yeah, it can make a huge difference in your recovery.
So if you think you or someone you're with might be having a heart attack, don't hesitate, don't wait. Call 911 immediately.
That's the best thing you can do.
All right, moving on. Chapter 6 covers a few more conditions. Next up is AFib, or atrial fibrillation. And this one is characterized by an irregular heartbeat. The book calls it an arrhythmia.
Right. It basically means your heart isn't beating in a regular rhythm. It can be constant or it can come and go.
And the symptoms can vary too, right?
Yeah. Some people with AFib don't have any noticeable symptoms at all.
Oh, wow.
But others might feel their heart racing or fluttering. They might feel palpitations like their heart is skipping a beat.
Mm-hmm.
They might have chest pain, feel confused, short of breath, weak, especially during exercise. Or they might even experience those symptoms of shock we talked about earlier.
Right. So again, if you're experiencing any of this, talk to your doctor.
Definitely.
Yeah.
And the book actually dives deeper into AFib and its connection to stroke risk in Chapter 14.
Oh, good to know. We'll have to check that out. All right, the last condition that Chapter 6 covers is congestive heart failure, or CHF.
Right.
The book explains that this happens when your heart gradually loses its ability to pump blood effectively.
Yeah, it's a slow process that usually develops over many years.
And it can be caused by a lot of things, right?
Yeah, there's a whole list. Things like blocked or narrowed blood vessels, a weakened heart muscle, damage from previous heart attacks.
Mm-hmm.
Even just the natural aging process can weaken your heart.
Makes sense.
And then there's long-standing high blood pressure, which can thicken your heart muscle.
Okay.
Damaged heart valves. Diseases that specifically attack your heart muscle. Congenital heart defects, which means you're born with them.
Mm-hmm.
And infections of the heart valves or heart muscle.
Wow, so it's a pretty complex condition.
It is. And the symptoms can be kind of varied too.
Yeah. What should people be looking out for?
Well, the book lists a bunch of them, but some of the key ones are sudden weight gain, shortness of breath, swelling in your feet, ankles, legs,
Okay.
swelling or pain in your abdomen, trouble sleeping because you're short of breath,
Mm-hmm.
a dry cough that gets worse when you lie down,
Mm-hmm.
feeling constantly tired or weak, confusion or difficulty thinking, coughing or wheezing during physical activity,
Oh, wow.
coughing up pink or bloody mucus, dizziness, fainting, having to pee a lot at night, loss of appetite, low blood pressure, a rapid heartbeat.
Wow, that's a lot.
Yeah, it can be a lot to keep track of.
Yeah.
But the main takeaway is if you're experiencing any of these symptoms, you need to talk to your doctor right away.
Right. Don't ignore these signs. All right, so we've talked about the risks. We've talked about the conditions. Now, Chapter 6 shifts gears and focuses on what we can do about all of this. It talks about lifestyle factors, things that we can control.
Right. These are the things that can make a real difference.
And it starts off by talking about diet. And it points out that there's been a shift in how we understand the link between what we eat and heart health.
Yeah, it used to be that high-fat diets were considered the main culprit.
Mm-hmm.
But more recent research shows that diets high in simple carbohydrates, those refined sugars and starches, are actually much more problematic. And it all comes down to insulin resistance.
Mm-hmm.
When you eat a lot of simple carbs, your body has to produce more insulin to process them. And over time, your cells can become resistant to insulin. And that sets you up for all sorts of problems, including heart disease.
So what's the advice? What should guys be eating?
Well, the book is pretty clear on this. It says, cut back on simple carbs and sugars. Focus on whole, unprocessed foods.
Okay.
Lots of fruits, vegetables, nuts, non-GMO whole grains, things that are high in fiber.
Makes sense.
And for protein, lean meats, fish, beans.
Good stuff.
And try to avoid those highly processed foods as much as possible. The packaged stuff, the boxed cereals, the white pasta, the baked goods, those are the things that are really going to spike your insulin levels.
Right. And for anyone who wants to dive deeper into the nutrition stuff, the book points to chapters 31 through 36.
Yeah, lots of good information in there.
All right, so besides diet, what's another big lifestyle factor?
Exercise.
Of course.
The book recommends getting at least 30 minutes of moderate intensity exercise most days of the week. And it emphasizes that you don't have to do it all at once. You can break it up into shorter chunks throughout the day.
Right, so a brisk walk with the dog, taking the stairs instead of the elevator, even just doing some yard work, it all adds up.
Exactly. And the book says that if you're already pretty healthy, this amount of exercise can cut your risk of high blood pressure by 25 to 50%.
Wow, that's significant.
It is. But the book also stresses that if you have any heart conditions, you should definitely talk to your doctor before starting any new exercise program.
Right, safety first.
Always.
All right, what else do we need to know about lifestyle changes?
Well, we've got to talk about smoking.
Oh, yeah, that's a big one.
If you smoke, you got to quit.
Yeah.
And if you live with someone who smokes, encourage them to quit too. Secondhand smoke is just as dangerous.
Absolutely. And what about alcohol and caffeine?
The book recommends limiting both. No more than 2 caffeinated drinks a day and no more than 2 alcoholic drinks a day.
So moderation is key.
That's it.
And then there are regular checkups. The book emphasizes getting your blood pressure checked regularly and having those routine physical exams.
Right. Don't skip those appointments.
And it also makes a really important point about reporting any symptoms to your doctor, even if they seem unrelated to your heart. Things like erectile dysfunction or even symptoms of depression can sometimes be linked to cardiovascular problems.
Yeah, your doctor needs to have the full picture.
Absolutely. All right, and finally, Chapter 6 talks about the importance of relaxation and stress management. It even says that things like petting animals or watching fish can help lower blood pressure.
Yeah, those are the little things that can make a difference.
And then there are more structured relaxation techniques like meditation, yoga, tai chi.
Those are great for reducing stress and promoting overall well-being.
Awesome. All right, so we're nearing the end of Chapter 6, and the last major topic it covers is high cholesterol. And it starts off by talking about how our understanding of cholesterol has evolved over time.
Yeah, it's pretty interesting. It used to be that we thought dietary cholesterol was the main driver of high cholesterol levels in the blood. But now we know it's much more complicated than that.
Mm-hmm.
A diet that's high in sugar and simple carbs that actually plays a much bigger role in raising those harmful blood fats.
Wow. So it's not just about how much cholesterol you're eating, it's about the overall quality of your diet.
Exactly. It all comes back to those simple carbs and sugar.
All right, so the book talks about the different types of cholesterol, right?
Yeah. There's total cholesterol, which is basically a measurement of all the cholesterol in your blood.
Okay.
And then there's LDL cholesterol, which is often called the bad cholesterol because it's the kind that can build up in your arteries and form plaque.
Right.
And then there's HDL cholesterol, which is the good cholesterol. It actually helps remove LDL from your arteries.
Oh, that's good.
And then there's this newer thing called oxidized LDL.
Oxidized LDL.
Yeah. It's basically LDL that's been damaged by free radicals in your bloodstream. You can think of it like rust. And this oxidized LDL, it's particularly harmful to your arteries.
Got it.
And the book mentions that there are more advanced tests that can give you a really detailed breakdown of your cholesterol levels. It's called VAP testing, or vertical auto profile testing.
Interesting. And why would someone want to get that done?
Well, it can give you a more precise picture of your risk and help your doctor tailor a treatment plan specifically for you.
Makes sense. Well, I gotta say, Chapter 6 of The 21st Century Man is packed with information. It really gives you a comprehensive overview of heart health.
It does. It's a great resource for anyone who wants to understand this stuff and take control of their heart health.
100%. And we encourage all of you guys listening to check it out. Read the whole chapter, read the whole book.
It's well worth your time.
All right, so that wraps up our deep dive into Chapter 6, where we explored all the ins and outs of reducing your risk of heart disease. We talked about the key risk factors, the different cardiovascular conditions, the lifestyle changes you can make, and all the nuances of cholesterol.
Hopefully, this has given you some valuable information and some practical steps you can take to protect your heart.
Absolutely. And remember, staying informed and being proactive about your health is key. And this book, The 21st Century Man, is an excellent guide.
Don't wait until you have a problem. Start taking care of your heart now.
Great advice. And make sure you join us next time for another deep dive into the 21st Century Man. We'll be tackling Chapter 7, which is all about preventing cancer.
Looking forward to it.
See you then.